Hi, I'm Dr. Michael Craig with Dr. Spine in India, and today we're going to talk about an interesting topic to most of you who suffer from headaches, migraines, neck pain, shoulder pain, arm pain, things that relate to your sinuses, your ears, your eyes, things like that. Anything above the shoulders, and actually including the arms as well, arms and fingers, like numbness or tingling in the arms and the fingers, things of that nature. The thing about it is they're all related. And they're related to something called the cervical spine. The cervical spine is the neck. And so this is an x-ray of the neck. You've got 7 bones in the neck, starting with the atlas. Atlas used to hold up the world in mythology. The atlas bone holds up the skull, and your whole spinal cord passes through the atlas, as well as the other cervical bones in the neck. It goes down the spine, and then you also have this whole thing going down to your tailbone. Now, what happens when you have a headache? What happens when you have neck pain, arm pain, shoulder pain, things like that? In chiropractic, we talk about misalignments of the spine with nerve interference. Those two things. The spinal segment is misaligned, which means it's a little bit out of place, out of position, and then there's nerve interference. Interference with the nerves, in particular the nerve roots that exit the spinal cord, come out of between these little holes called foramen and go down into your shoulders and your arms. This happens, for example, if you have shoulder pain, most of the problems you're going to have come from the neck. In fact, it comes from mostly the middle part of the neck, called C4, C5, C6. That area is going to be either straight or it's going to be slightly reversed. Normally in the neck, you've got a nice curve in the neck. This has got a little bit of a curve, this person, but not a fully curved neck, so it's not completely normal. A normal neck would usually have a little bit more of a curve attached to it, and this one's a little straighter. So this person has some shoulder pain. And so with reason, you can see here, C3, 4, 5 are all straight. Actually, C3, 4, 5, and 6 are all straight. There's no curve in there. So they're going to have a little bit of stress on the nerve roots in the back that exit the spine. Consequently, they have shoulder pain. Headaches, on the other hand, can come from several sources. And I can talk about headaches very well because for most of my life, I had headaches. Something akin to migraines, mostly cluster headaches. But headaches are a terrible thing. I know exactly how you feel if you have them. I've had them myself. So the first things I look at as a chiropractor are 3 causes of headaches. First of all, either you've got a physical problem. In other words, this is related to an imbalance in the spine itself. There's a misalignment with nerve interference. You've got a chemical problem. For example, you may be allergic to certain foods, or you could have something that I have recently found to be a congested liver, and there's ways that I test for that. The third reason for headaches or migraines could be that you've got some mental, emotional stress that's been going on in your life for a long time that, as a chiropractor, I can also check. Now, the first thing for headaches is that I start with the physical causes first, just to make sure that that's not balanced. With this person's neck, I don't know if you can zoom in, but there's a problem with this person's atlas. If you look at the atlas at the top, there's a little bit more of a gap on this side of the atlas than on that side. We're looking at it from behind, and this is the right side, that's the left side. So we could say this person has a right atlas because there's more laterality, there's more gap on this side of the spine than that side. And this is something called the odontoid process. Don't need to get into that, but that's part of the second cervical vertebra. So I can tell from looking at x-rays and also from doing motion palpation with subjects or with patients whether or not the person has a restriction in the atlas, the axis, or C3. Usually those are the areas that involve headaches, as well as the occiput, this part of the skull which connects with the atlas. So in that area is very delicate, very sensitive, and headaches often occur because of misalignments in atlas. This person had headaches. They also had a misalignment of the atlas. By correcting the atlas, we correct the headaches. Now, the second cause would be chemical or dietary. If you have a certain diet, for example, and you're not aware that you have food allergies, you need to be tested for that. You need to find out whether or not those foods are affecting you chemically, and it goes into the liver, and the liver gets congested. I found that congested liver leads to a lot of pain in all the muscles, and can also lead to pain in the head, because the head is the most sensitive area. The brain is the most sensitive area because the blood-brain barrier is very thin there, and you're going to feel a lot more in your head because of that. I know this personally because I had this condition. I had a situation where I had a congested liver, did not know about it most of my life. What I do in those cases is I also adjust the spine, but I recommend to people they take certain herbs, change certain foods, do certain things. There's particular herbs that I recommend, which, for example, milk thistle, which is a great herb for that. There's also some Ayurvedic remedies, things that you can use to help yourself. And the third cause is mental emotional. Mental emotional would be that if you have lost someone recently, had the death of someone, you recently got divorced, you recently had a trauma in your life, the loss of a child, the loss of a loved one, anything, any loss or any current circumstances that suddenly abruptly have changed can cause a stress in your spine, in your nervous system, and it could cause problems in your neck as well. Usually you have both the physical and the emotional problem going on at the same time. I would adjust your spine, but I would also make sure that we're dealing with the mental emotional issues. I've had people come in if they look very upset. Usually I try to find out what's going on, because healing cannot take place if you've got mental emotional problems going on. I generally get to one of those three causes of headaches, and either one or all of those will clear it up. The second thing would be the neck pain. If you have neck pain here in the middle of the spine, as I said, you're going to have shoulder pain and maybe arm pain. Tingling, numbness is very common in those people who have very chronic or reversed spine in this area. And the lower part of the neck can also affect the upper back. It can affect your immune system. C7 affects the immune system as well. That's very important during these cases of COVID-19 where lockdowns are very prevalent. So you want to be able to make sure that your immune system is taken care of. C7 is very important for that, as is the atlas, because the atlas will also affect, you can swing over here and see, the atlas also affects this nerve called the vagus nerve, which goes down and affects just about every organ in your body. And that particularly is associated with the first cervical vertebra. So you see there are a lot of things that can happen in your cervical spine that as a chiropractor I can help you resolve. I can work with you, get you back to a state of normal where there's no pain, very little symptoms if any, and help you get back to the road of health. I'm Dr. Michael Craig, Dr. Spine in India. I wish you a wonderful day and week, and stay safe.